everybody. My name is Jolene, and I've written my paper on improving the communication process, specifically in the PACU setting where there's a lot of back and forth of that going on. First, a little bit about me. Well, again, my name is Jolene, and I've been a nurse for over 20 years. 8 years of that nursing has been in med-surg nursing. The other 14 years has been in PACU. I basically grew up there. Why I choose communication? We all know that communication matters at every level of healthcare, especially when it comes to nurse to nurse. It is the foundation for safe, high quality, and effective care. Good communication builds on trust, empowers everyone, and helps care teams work together effectively. Communication has been one of the most common and significant challenges in healthcare across the board, from top to bottom and all around. We have all had communication issues at some point or another with whomever or however. It's just a constant evolving of making it better and better and better. Communication is important at every level of healthcare. It's the foundation of safe, high quality, and effective care. Good communication builds trust, helps everyone feel empowered, and allows the care teams to work well together across the path of the patient's healthcare. Me, I was lucky enough to have Mr. Smith, the actual manager of quality at New Orleans East Hospital, where I work at, to mentor me throughout this course. At our first meeting, I shared my interest in improving communication. Together, we decided that the handoff tool is a great area for improvement. My problem statement we came up with is that inconsistent communication during a PACU handoff reports leads to workflow problems, such as delayed patient care and a higher risk of patient safety errors. How do ineffective communication affect our patients? One of the main issues is that some information might accidentally be left out during a care transition. Of course, after surgery, our patients are often sedated, in pain, possibly unstable, their vital signs, overall in a very vulnerable state. In PACU, we receive these patients who just receive a great amount of anesthesia drugs, including, paralytics, sedatives, and a great amount of pain medicine. They are at a great risk of, going apneic. That's the major side effect of it all. They stop breathing. As the drugs wear off, it's up to us as the nurse to ensure their safety. We're fully responsible for their care. We need to know what drugs that they had, how much, and the complications, if any, during the transition, which why, of course, in our space, communication is so important. We literally have these people's lives in our hands. Let's talk about problems that happen during the handoff process. Let's start with distractions. Of course, alarms. The SpO2 going off. You got a patient going apneic. The IV pump is going off. Somebody got a kink somewhere, their arm is folded. That always happens. Wound vac, of course, you lose suction as soon as something else happens. And of course, your current patient, you got to meet their needs. Either they're in pain or something's going on with them. It's just always something. As far as getting a report from your next nurse or your OR nurse, it's different people that give different information in different intervals. And so if there's no standard method of giving a report, that everybody is just a bunch of information everywhere. It's just really a lot. And it just adds to the frustration of trying to keep everything together for the nurse. And time pressure is always a thing. The OR nurse got to get back to the OR to complete her task, and then the receiving nurse, the PACU nurse, have to hurry up and get back to her duties as she got a new patient and she got the diaries taken care of. Everything is always such a rush. It's just constantly going. We got to figure out a better way to do this. Why do we need to fix these problems? Research has shown that communication breakdowns account for nearly 70% of serious adverse events reported in hospitals per the drug commission. For the patients, poor communication causes medication errors, treatment delays, unmanaged pain, which also leads to poor patient satisfaction reviews, and other complications after surgery. For the nurses, the communication breakdown causes us stress, makes our jobs hard, lowering our confidence, overall leads to burnout. For the company, inadequate communication can hurt patient satisfaction scores, safety outcomes, staff morale, and an increase of unnecessary healthcare costs from preventable errors. The plan for change rationale. Well, the plan is to use a standardized handoff tool based on the SBAR framework. This was chosen after finding several reasons for poor communication. Again, inconsistent reporting, interruptions, time pressure, different communication style that leads to unclear expectations. Next, the implementation. First, we will collect data for about 4 weeks prior to starting. By reviewing this prior data, we should see a pattern to fix. Next, we will meet with key leaders such as our clinical supervisors and our charge nurses, the one that are more hands-on on the floor, and they will help create a tool tailored specific needs to the PACU. Then, we will introduce the tool and explain the importance. Then we begin to train the staff on how to properly fill it out and then go live. We will do a 2-week pilot during day surgeries, document feedback from staff, and make necessary changes. We then will provide coaching and support as needed. In the 3 months, we will check the barriers to change, the compliance, and the staff satisfaction. Incident reports and share the findings at our monthly meetings. Let's visit the idea of the financial cost of the change, because that's very important. The main upfront cost is for staff education and training time. Time is very important. Nurses make between $30 and $40 easy, so money is very important in this matter. Next is printing up of the education materials, because ink and paper cost money. IT, computer support, they're always around and available for questions. Administrative work, because there are always somebody at the top looking at us and what we're doing and making adjustments to why it's important. The compliance checks, they have to have people to make sure everything is going accordingly, and of course the surveys to make sure that everything is working accordingly and that the information that we're giving is applied to what we should be doing, and to get the feedback to make sure everything is working. So as far as my timeline, I expect this project to take about 6 months to finish. Month 1, we will design a tool, get approved from leaders. Month 2, we create educational materials for training for staff. Month 3, go live, provide support, and gather feedback. Month 4, we will revise the tool, all the process to make it work for everybody. In month 5, we monitor compliance, collect results. In month 6, share findings with leaders and staff. We need to make this work. Evaluation. Evaluation is an important component of the QI process because it measures whether changes in practice lead to meaningful improvements in patient outcomes and staff performances. After we introduce the handoff tool, we'll follow a structured evaluation plan to see if the project meets its goals and to keep finding ways to improve. In summary, the main goal of this project is to raise compliance with a standardized handoff communication tool to at least 90% within 3 months, and to reduce communication-related errors during patient transfers from the OR to the PACU, so on. It takes effort from all of us, the surgeons or nurses, practicing nurses, unit nurses, anesthesia doctors, leadership, and so on, to help continue improving the communication process. Thank you for your time. I hope you found my PowerPoint insightful. I wish you all the best on your journeys.